Hello there, and a very warm welcome to another edition of Channels Beam on Channels Television. I'm Victor Matthias. Now, Nigeria's coronavirus cases have continued to rise since the easing of the lockdown by the federal government, and that has rekindled the debate as to whether there was any need in the first place to relax measures put in place to help flatten the curve. Now, over 500 cases were recorded last week on Saturday alone, the highest since the index case was reported. So today on the program, we will look at what can be done to curb the further spread of the virus. But before we do all of that, let's take a look at what made the trends in the social cyberspace in the past week.
It was a week of brutal incidents in Nigeria and the United States. First, the murder of a 17-year-old girl, Tina Ezekwe, who was allegedly shot dead by a policeman and eventually died in hospital, leading to the call for justice for the slain child by Nigerians. It was followed by another call for justice for another girl who this time was allegedly raped and murdered in Benin City, the Edo State capital, Uwa Mozua. Nigerians are calling on the police to find the perpetrators and bring them to book so as to prevent a recurrence. And in the United States, protests have occurred in several cities amidst the coronavirus pandemic, with social distancing ditched to seek justice for George Floyd, on whose neck former Minneapolis policeman Derek Chauvin, who's been charged for murder and manslaughter, knelt on as he pleaded, "I can't breathe," till he died.
Well, sad trends from the past week, but you can be a part of this conversation from anywhere you are watching around the world. Just tweet at us using the hashtags as well as the social media addresses you're seeing on your screen. We have a Channels TV at ChannelsBeam at Victor_MBIDI and also hashtag ChannelsBeam as well as easing the lockdown. But let's get to meet our panelists for today. We have joining us via Skype from Lagos, Sheo Nogumbure. He is a healthcare practice and a project manager. He has an MBA from OAU and a certificate in economic evaluation of healthcare from the University of Washington School of Global Health. He is passionate about achieving universal healthcare, and he manages several healthcare practices in Lagos, Nigeria. Sheo, it's a pleasure to have you on the program today.
Thank you, Victor. It's a pleasure to be on the program.
Of course. So let's begin with the rising cases of COVID-19 in Lagos, despite measures being put in place by the government to ensure that the curve is flattened. What do you think is responsible for the spike in these cases?
Okay, I would say that the first thing that we should understand is the best way we can actually understand the pattern of the disease is by testing. And testing is, we need to keep testing more. So what we currently have as a reality in Nigeria today is still a case of we under testing. Yeah, the numbers are increasing, but if you compare those numbers with numbers in countries like Australia, South Korea, South Africa, and even Nigeria, you would discover that we are under testing. For example, in Australia, for every confirmed cases, they have done 195 tests. For every confirmed case in South Korea, they have done 78 tests. For every confirmed case in South Africa, they have done 24 tests. But for every confirmed case in Nigeria, we've only done 6 tests. You can see the gap, the difference between what is happening in Australia, South Korea, South Africa, and Nigeria. So what we are seeing is a reflection of the fact that, yeah, the numbers are increasing, but then we are not anywhere near flattening the curve just yet. Because the more we test, the more we understand the disease pattern, the more we understand the demographics, in terms of population that are more at risk, in understand those that are at risk the most. Yes, we understand that those with comorbidities are the most affected for the recorded case of deaths. But then we need to test more. When we test more, then we can actually understand the pattern of the disease locally, and then we know what to do next.
Okay, I mean, talking about what to do next, since we're still at that stage where we're trying to get ourselves, or we're trying to get more people, or, get more people tested, at least with what we have at the moment, it's still scary. So what can we do, apart from what we've been doing, to ensure that the cases don't go beyond where they are?
Okay, in terms of testing as well, I would tell you that there are very few cases, there are very few states that are doing quality work in terms of testing. A case in point is the government of Lagos State. Yeah, they can do a lot more in terms of testing, but then you and I know that if you check on the NCDC's website and their social media channel, there's a particular state that up until 2 weeks ago, the governor was refusing them testing. And all the activities of the various states with regards to testing, they are more of individual efforts. Yeah, there's a support from the presidential task force on COVID, but then there's a case in point I want to reference. About a month ago, one of the cases that was confirmed in the neighboring states of Lagos, Ogun State, was a case of a policeman. The case was confirmed, it traveled all the way from Lagos to Ogun State, but then there was no proper channel of communication. The case was confirmed in Ogun State, but there was no contact tracing back in Lagos for the people this person has had contacts with. So that's one of the bottlenecks we are having with regards to testing adequately. So we cannot, the numbers will continue to rise, because if you go out there on the streets, you will find that the government has said everybody should go out with a face mask. People go out they've improvised the face mask, is now a chin mask. The mask is right under their chin, their mouth and their nose is opened. And then they think, oh, just hanging it on their ears and having it under their chin, that's all. I think because most people also are not informed as much as possible, despite all the effort that is being put in place on local and international media to actually localize the message about the impact of COVID-19. So we need to do a lot more sensitization, and we also need to get all the states and arms involved in eradicating this disease or flattening the curve. We need to get them to work in sync. There are a lot of disjointed efforts.
Yeah, so speaking about getting them in sync, some have also argued that the nation's healthcare system is not perhaps ready, so to speak now, to contain all of the cases, because as the numbers are rising, there's also the need for them to be taken to the hospital, and the hospital already was battling with, so many issues even before now. So how do we have enough staff strength now in terms of medical practitioners, to handle, together alongside what we have on ground with the cases we're having?
Okay. One of the things that I've discovered as a result of observing the trend of COVID is that, and that's part of the reasons it's like most people in this part of the world are not taking it serious, because we've had very mild and moderate cases. Most of the cases we've confirmed are people who were asymptomatic. Now, for us to be able to do more, we need to do a lot of private sector collaboration. Yes, I know Lagos State government is accrediting some facilities to serve as isolation centers for COVID, to isolation and treatment center. Yes, to buttress my point about partnering with the private sector, there's something 54 Gene and Niger Flying Doctors, Dr. Ola Brown, what they are doing to also ensure, so those are private sector collaboration, to say that, one, we are testing more and then we are reaching more people. So the government needs to ramp up and find a way to reduce bureaucracy in order to be able to look for more facilities, more healthcare facilities now, accredits them, gets them to know the treatment regimen that has worked as so far with those cases that have been recovered or discharged, and then cascade it to those healthcare facilities. That way, the government-owned facilities for isolation and treatment is not overburdened, because the more we test, the more cases we will find. And we do not have the capacity to put them all in the government-owned facility. Thank you.
So what would be the next step now? Because I mean, obviously, let me just even take you through some of the figures. Last week, we actually had the highest number of cases since the index case was recorded. On Monday, we had 299. On Tuesday, we had 276. On Wednesday, we had 389. On Thursday, 182. On Friday, 387. And then on Saturday, something happened. We had 553. It's the highest we've had in a single day since the index case was reported. And then yesterday we had 307. In total, we recorded 2,393 in just last week. So these are scary figures. And then, so moving forward now, you've actually made mention of, the government's part, the private sector, how they need to come together. And you talked a bit about how people have turned the face masks into a chin mask now. So what more responsibility, or what responsibility do citizens have in ensuring that we flatten this curve?
Okay, our responsibility as citizens, in my own part, I have quite a number of people who are not literate. I ensure that I take them through, I teach them, and I remind them on the need and importance of maintaining personal hygiene, because nobody is safe until we all are safe. If I take responsibility for my own safety and I do not take responsibility for the next man behind me, then I am not ready to flatten the curve. Another thing I know the government can do, because this at the point we are now with regards to wearing face covers, the government needs to set up local enforcement teams. Get the language. It's a pity that the language most Nigerians understand is brute force. It's quite unfortunate. With the amount of information out there in mainstream media, I don't think people should actually move around without having a face mask. But at this point, the compliance level is really low. Somebody was telling me about what is obtainable in a southwest state, and they said the vehicle still have 2 passengers in front and 3 passengers at the back, which is the maximum, the usual capacity they were carrying pre-COVID. And that is what is still obtainable as we speak. So the government needs to set out people that understand the importance of this, make a few examples of people who have turned their face mask to chin mask, get them arrested, not put them in jail or something, get them to pay a fine, something as low as maybe 2,000 naira or 5,000 naira. If they pay that maybe 2 or 3 times a week, and then get their names, publish it. You have like an offenders register.
All right.
For people who do not comply with the guidelines of moving around in public.
All right, Seun, I have to say thank you for joining us on the program today and sharing your thoughts. Thanks once again.
Thank you very much.